Osteoporosis is a bone disease, and it occurs when the body loses too much bone, makes too little bone, or both. As a result, bones become weak and they may break from a fall or, in a serious case, from sneezing or minor bumps. Osteoporosis means porous bones. Viewed under a microscope, healthy bone looks like honeycomb. When osteoporosis occurs, the holes and the spaces in the honeycomb are much larger than in healthy bone. Osteoporotic bones have lost density or mass and contain abnormal tissue structure. As bones become less dense, they weaken and they're more likely to break. Metabolic acidosis can lead to a loss of bone in your body. A link has been shown between the consumption of pasteurized milk and its increase in osteoporosis. This may seem counterintuitive as milk contains calcium. However, the acidic environment that pasteurized milk creates can cause a state of acidosis and in turn can leach calcium from your bones in order to buffer your blood's acidity. Interestingly, raw milk has the opposite effect and can be very beneficial to patients who are experiencing osteoporosis. In vitro studies demonstrated that osteoclasts, the bone cells that dissolve bone, are activated at a low pH, around 7, and they become progressively less active as the pH rises and approaches 7.4. This is one reason to adopt an alkaline diet when dealing with osteoporosis and avoid acidic foods like sugar. Vitamin D helps the body to absorb calcium and phosphorus from the food that you eat, so the nutrient is important for people with osteoporosis. Studies show that calcium and vitamin D together can build stronger bones in women after the menopause. It also helps with other disorders that can cause weak bones like rickets. In order to assess your vitamin D levels, get a 25-hydroxy vitamin D blood test and then supplement accordingly. Vitamin D works synergistically with vitamin K2. Vitamin K2 appears to protect the bones more than vitamin K1, but too little of either is bad for the bones. Studies have shown that poor vitamin K intake is linked to low bone mass, osteoporosis, and fracture risk. Women who consumed less than 109 micrograms of vitamin K per day were found to be more likely to break a hip. More than 300 micrograms of vitamin K2 cannot be absorbed, so any more than this would be wasting it. See the work of Dr. Weston Price and his study of vitamin K2, which he labelled Activator X, for more information on this. MSM has the potential to be used as a therapeutic agent to treat bone-depleting conditions, such as osteoporosis, where the mineralization of bone is impaired due to the decreased osteoblast differentiation. MSM is a form of sulfur which can have many benefits for the body, particularly in relation to osteoporosis. It also helps to balance the pH. Doses can be up to 30 grams per day. However, this dose should be built up, as many experience detoxification symptoms when they first take MSM. Taking MSM with vitamin C can help to reduce this detoxification, as the vitamin C has the ability to bind to the toxins and easily remove them from the body. Vitamin C is widely known as a powerful antioxidant, as well as an effective cell protector and immunity booster. But supplements of vitamin C have recently been recognized as having an important role in the prevention and the treatment of osteoporosis because of its ability to increase bone density. The best forms of oral vitamin C are firstly liposomal vitamin C, then non-acidic vitamin C, with the worst kind being ascorbic acid due to its ability to cause stomach upset and its highly acidic nature, which would be detrimental in cases such as osteoporosis. Collagen is the most abundant protein in the human body. It's found in the bones, the muscles, the skin, and the tendons. It's the substance that holds the body together. Collagen forms a scaffold to provide strength and structure. Hydrolyzed collagen has a positive therapeutic effect on osteoporosis and osteoarthritis, with a potential increase in bone mineral density and a protective effect on articular cartilage and especially in the symptomatic relief of pain. Doses range from 5 to 30 grams per day. It can be sourced from fish or animals. Hyaluronic acid is well known for its skin benefits, especially alleviating dry skin, reducing the appearance of fine lines and wrinkles, and speeding up wound healing. It can also help to relieve joint pain in people with osteoarthritis. New animal research has begun to investigate the effects of hyaluronic acid supplements on bone health. 2 studies have found that hyaluronic acid supplements can help to slow the rate of bone loss in rats with osteopenia, which is the beginning stage of bone loss that precedes osteoporosis. Doses of 240 milligrams per day for at least 1 month have been shown to significantly increase skin moisture and to reduce dry skin in adults, so this might be a good starting dose for osteoporosis also. Deer antler velvet is a natural substance with over 300 bioavailable molecules, and it may be beneficial. Some researchers believe that the velvet antler may have the ability to rebuild bone in people with this degenerative disease. The velvet antler is rich in calcium and phosphates. It's an extremely fast-growing tissue comprised of fibroblasts, chondroblasts, and chondrocytes, required for healthy growing bones and tissue. New research suggests that deer antler may help to cure debilitating bone diseases like osteoporosis. Typical doses start at 500 milligrams per day, but they can go much higher. Don't purchase a deer antler IGF extract spray, as these are not useful. Royal jelly is harvested from the queen cells of beehives, and it's sold as a supplement or in skin creams to enhance collagen production, to ease premenstrual and postmenopausal symptoms, and to improve overall health. Royal jelly and bee pollen decrease the bone loss due to osteoporosis in a rat model. These results may translate to human osteoporosis cases also. Growth hormone supplementation continued to reduce the risk of fractures, and it helped to maintain bone density in postmenopausal women who had osteoporosis. This was according to a new study published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism. Some ways to increase growth hormone are by using melatonin to improve your sleep, intermittent fasting, high-intensity interval training, or the research chemical MK677 at 12.5 milligrams per day. You should note there's a relationship between growth hormone and blood sugar. Therefore, blood sugar management should be taken into account if supplementing with something like MK677. Sugar is also considered highly acidic. Therefore, blood sugar should also be managed with osteoporosis anyway. You could check out my other video on blood sugar for more information. Strontium has been prescribed in Europe for years to promote healthy bone aging. Strontium is a trace mineral whose metabolism is closely linked to that of calcium. It resembles calcium at the molecular level. Strontium concentrates in the skeletal system, where it plays a key role in supporting bone tissue density. Doses of 750 milligrams per day of strontium as strontium citrate can be taken. There's an over-reliance and a hype regarding high calcium doses for osteoporosis. However, this can be dangerous if there isn't sufficient magnesium in the diet. A magnesium deficiency contributes to osteoporosis directly by acting on crystal formation and on bone cells, and indirectly by impacting on the secretion and the activity of the parathyroid hormone and promoting the low-grade inflammation. The best form of magnesium would be magnesium bisglycinate. In order to determine your dose, you should slowly increase until you see side effects such as stomach discomfort or diarrhea. Then slowly reduce the dose until the side effects disappear. This allows you to determine your optimal maximum daily dose. As magnesium is required by the body for the proper functioning of hundreds of enzymes, a profound result may be noticed in all areas of your health after a few months of use. Unless you can source raw milk, I would not choose dairy as a calcium source for osteoporosis. Also, synthetic calcium supplements would not be recommended. There are, however, many natural, healthy foods that contain calcium that's bioavailable. Heavy alcohol use increases a person's risk of developing osteoporosis, and there's many effects of alcohol on bones and joints, such as causing them to become more brittle. Studies provide the first evidence of the ability of SARMs like S4 to prevent bone loss and to improve bone strength in females, and it's suggested that SARMs hold great promise for the treatment of osteoporosis in both men and women. See my other video on why people are turning to SARMs for more information. You can check out my website for more information on the herbs and supplements discussed in this video.